several days. This is an encouraging first sign that the program is increasing accessibility to tests for the campus community. The relatively low rate of positives on campus is also a reminder that masks, social distancing, and regular hand washing work to control the spread of the infection. This is particularly important as we begin to see the arrival of winter visitors to Tucson and Southern Arizona as they are beginning to move and as we're beginning to move toward the holiday season. With this in mind, I want to note that we are excited to host parents and other family members and friends for Family Weekend next week, starting Friday, October 8th, and we will also hold the university's homecoming a few weeks later, beginning October 31st, culminating on November 6th. Both of these events will be exciting opportunities to bring the Wildcat community together, and I encourage everyone who joins us to mask up and practice public health measures to keep us all safe. I'll turn it over for Dr. Carmona, who will share some details about key public health data. Thank you, Rich.
Thanks, Bobby. Can I have the first slide, please? So again, thank you all for hanging in there with us for the last year and a half and joining us for these presentations. You know, President Robbins has been very, very supportive of us being totally transparent, sharing what information we have with all of you. So you, our family, our staff, our community can make better decisions based on all of that information. So we see the 7-day rolling averages again. We're doing pretty well in Pima County. Arizona as a state doing pretty well, getting better. And again, when I look at these numbers, the thing that makes me pause is, okay, it seems we've achieved some stability, a little over half the country vaccinated, especially in our state. The majority of seniors are vaccinated, but we still have a ways to go. We can't let down our guard. And as the president said, even though we're going to try and do the best we can with recreation and getting our school open and all those things we want to do, we've got to be careful. And we still need to do everything we can to practice those mitigation strategies. And everybody should be getting vaccinated. Everybody, unless you have some medical reason not to, or some personal reason, which we respect, get vaccinated. Next slide. So we look at the COVID testing results, as the president has alluded to, and you can see overall, we're doing pretty well. I mean, we're keeping down in the 1-2% range of positivity. Again, that's a reflection of the amount of vaccinated people we have coming on campus, the fact that we're testing, the fact that we're doing everything we can to decrease transmissibility. And so we're happy with this, but we're never complacent. We still want to do better. Next slide. And again, if we look at our RT, remember those are the transmission values that we look at. If we look at Pima County in Arizona below 1, and that's really good. We attribute the 1.9, which is our zip code where the university is in our surrounding community, a little over 1, but that's probably a reflection of students coming back to school and people in the area moving in and out of our campus, because we've emphasized and re-emphasized that University of Arizona is like a little city within a city. And we are always having people going into the community coming to us, people visiting us. And so it's a challenge to make sure that we decrease transmissibility and do everything we can to keep the community safe and the community of the University of Arizona. But we watch these numbers very carefully and we track them to make sure that we don't miss any spreading or transmissibility. So overall, we feel good that we've done a lot, that we have a year and a half behind us of experience with this individual threat that has been really collectively bringing our nation and the world to its knees. And there's a light at the end of the tunnel, but we can't be complacent. We have to keep moving forward. Next slide. So again, the vaccination rates are in the 65 and over, incredible, as I said a little while ago, 18 and over at 78% almost. And overall in the state, we're approaching 60%. That's good. But on the other side of that, you have 40% of people who are not fully vaccinated. And that's where our vulnerability is. So that we need to make sure that everybody gets vaccinated. And for some reason, if you can't or choose not to, there's testing available every place so that we can make sure you're not carrying the disease and spreading it inadvertently. Next slide. So the catch takeaway testing, this is important. There's 9 campus pickup points. And so, there's the takeaway test. The president has made sure we have numerous options for you to get tested. Go to the website and you'll find out where those locations are. And if you have any questions, you can call in and get help any time of the day. But we want to make sure that there are no barriers between you and accessing the testing or vaccinations for that matter. Next slide. And so here's the question for the COVID Ambassador Team hotline. Please feel free to call, email 7 days a week, 7 to 7. Any questions that you may have, go there. We do the best we can to try and anticipate what your questions may be and give you good information. But we recognize there may be things that we haven't thought about that are important to you. Call that number and get those answers. So next slide. I think we're at the end over here, Bobby. And I'm cautiously optimistic like you are, Bobby. We've got a 1.5 year experience behind us now. Our university is starting to percolate once again. Our activities, our sports, our intercollegiate athletics, the Pac-12, and our university athletics have been fantastic in working with us to generate protocols that will allow us to get out from the COVID exhaustion and appreciate sports and intercollegiate relationships and so on. But again, we just have to keep emphasizing that we're heading in the right direction. We've got a good track record, but we can't become complacent now.
Yeah, I would agree, Rich. I still come back to even if we're all vaccinated, testing continues to be something that we'll need to do for the foreseeable future. And I'm glad to see that the takeaway testing has begun to roll out. I think we have sites, Holly, in Phoenix, at our College of Applied Science and Technology in Sierra Vista. Yuma coming soon, I think you told us. Right. And there was one other site.
Valley College of Veterinary Medicine.
Right. Yeah, the new veterinary school in Oro Valley. So I think that's all really important. But I almost look at it that everyone should just seek out a test. We've made it really easy. And at least once a week, just get tested to see where you are, because you don't want to be, even though you're asymptomatic, you don't want to be the person spreading this Delta variant. And so I continue to emphasize that testing is really, really important for all of us.
Yeah, it sure is. Are you guys ready for questions?
Yes.
Let's do it.
This might be the quickest briefing we have. Our new top favorite reporter, Craig Smith, who always gets the first question, is first in line today. Go ahead, Craig.
I'm not sure quite how to react to that. Anyway, for either of you, please elaborate about just kind of what you anticipate for homecoming. A little more about why you adjusted the dates, the kind of experience you're thinking people will have given conditions.
Yeah, I think, Craig, it's going to look like our first two home football games. For the tailgating, we're encouraging people to practice good public health hygiene, have masks if they're close together. But the good news is that most of the activities are outdoors. Despite having a little bit of trouble getting people into the stadium in the first game, that was solved the second game. And I think things have gone fairly well, asking people to have a mask before they come in, encouraging people to be vaccinated before they come to these large events. And if not vaccinated, to at least get a negative test. We don't want people coming to our campus and spreading the disease. I mean, it's that simple. So I would assume it's going to be the same going forward. For homecoming, I think we'll probably expect larger crowds. So it's even more important. The more people we have, the more important it is for everyone to adhere to these requests.
Do you have a follow-up, Craig?
No, I think I'm fine on that. Thank you.
Okay, thanks. The next question comes from Rocio Hernandez at KJazz, and she says, it sounds like the university is feeling optimistic about a downtrend of COVID-19 cases on campus. Do you think the university's COVID data is accurate as it could be, since the university isn't making testing mandatory for students and staff?
Yeah, I think it's as accurate as we can have given the limitations we have. We can't mandate testing. We can only encourage it. Now, when we have positive hits on wastewater tests, we are mandating testing. I think the good news is that most of the, I think the number is around 75% of our dorm students have been vaccinated. So even though they're vaccinated, though, I'll go back to what I just said, we still need to continue to test. So there's no question that the rate may be a little bit higher because we're not testing as much as we were, say, last year. We have the capability to do about 3,000 tests a day. I would like to see us test more. But as we've continued to increase our testing, the rate is continued to be under that 5%, in the 2% range. So, it's a good point. The more tests you do, the more cases you're going to find. But we've just not seen a lot of individuals with symptoms. The hospitals are, Dr. Carmona and I watch that data every day, and the hospitals are starting to see a little bit of a break, and it's not overwhelming the system. So I think on balance, it's about as good as we could hope, given the limitations that we have to operate in.
There are currently no more questions in the queue.
Wow.
So, I know. I think you guys are going to get off early today. Do you have any final comments that you would like to say this morning?
Well, Rich, anything? I mean, you're so involved on the national, international scene, and certainly at the state. We talked a little bit earlier this morning about the possibility of increasing the vaccine in the 5 to 12-year-old range, boosters. And as you pointed out, we're ready to go with boosters. And Holly, October 11th is when we'll open it up for boosters. And maybe, Rich, you could just repeat what you said about your philosophy and how we should all be viewing boosters.
Good. Happy to, Bobby. Thank you. First and foremost, we've been planning for this. As I say, it's our incident command system within the university, have been planning for these type of contingencies for some time. And so we have the ability to surge, meaning we can step up our activities, but we also recognize when boosters are available, doctors may have them in their offices, pharmacies may have them. There'll be many portals that people can go to that make it very convenient. However, the president wants it to be convenient for our students, staff, and faculty. So we've engaged with our student health on campus to be able to absorb that when and if it occurs. The issue of boosters is one that has generated a lot of media, but I would like to try and simplify it. And I'll give you my own case because I'm part of the University of Arizona study that is actually looking at how long immunity lasts. So I had myself tested to be part of the research and found researchers called me and said, "Hey, Rich, do you know your immunity is starting to drop?" And it was right about a 6-month level, 6, 7. Now, that doesn't mean I was not still protected, but the fact your immunity is dropping, because there's several different types of immunity, that you have to decide, well, gee, will a booster help? And the more people we can get into the study, we're able to answer those questions by age, by ethnicity, by gender, because we're all different. One size doesn't fit all. So I went and got a booster because of age, because of the fact that my immunity was dropping. So the idea there is that why take a chance? There's no downside with getting a booster. And we know that it starts to drop off after a little while, 6, 8 months in that ballpark. And again, it's not a perfect science yet because we've only done this for a year or so. As we get more information, we'll be able to look at vaccines for COVID, just like we do for measles, mumps, rubella, tetanus. We'll know how long the initial vaccine lasts and that you need a booster. Think of all your children that get vaccinated to go to school, and they have to come back in 6 months or a year or 2 years, whatever the vaccine happens to be. It's because we have a large body of information that tells us, you better get a booster right now because we know immunity starts to drop off. And again, remember, we didn't know about COVID a year and a half. We've done very well as a nation with the science, understanding this virus, this invisible threat, and being able to counter it pretty successfully through mitigation strategies as well as vaccination. So the booster is a good thing. If you fall into the high-risk group, if you are a transplant patient, if you have cancer, if you have chronic diseases that you take drugs that will immunosuppress you, speak to your doctor or your primary care provider and talk to them about should you get a booster and when you should get a booster. For the average person, if you're in any of the risk groups, including age, yes, get a booster when it's available to you. So I think that summarizes it, Bobby.
Yeah, I agree, Rich. And, ideally, we would all be able to get periodic antibody tests. It's just not practical. It requires a blood draw, and it's not practical to have it scaled. But it does give us great information for those individuals who have volunteered as a research subject to get these tests. It's highly instructive. But I think that, the people I've talked to who've had the booster, and I'd love to, since you've divulged to us all you've had a booster, what happened after your second dose and then after your third dose? Did you have any symptoms or any reaction?
My second dose, I didn't even know I had a vaccination. And my booster, my arm was a little sore. That was it. So it's a small price to pay for the benefit that you get, not only to yourself, but to protect your family, your community, and you contribute to the nation and the world in stopping transmissibility. Because as we said repeatedly, the longer this virus gets a chance to compete with us in the environment and it continues to mutate, we may get a variant that now makes our vaccine less effective. And there are no treatments for these viral diseases. So we're really talking about vaccine. So it is incumbent upon all of us to get vaccinated, get a booster when you are required to, or when you are asked to, based on your age and risk profile, because it's not only about you, it's about you contributing to the health of the community and the world by stamping out any possible place that this virus can go to and continue to replicate.
Yeah. Go ahead, Holly.
Oh, no, I was going to say I have a question that was emailed to me, but I'll let you finish your comments and then I'll ask you.
No, I think we're ready.
Okay. This one comes from Andrew Oxford from Arizona Public Media, and he wants to know, can you clarify at some point whether there'll be any changes in the university's policy when the new state laws on masks take effect this week?
No, I think everything we're doing, and I'd welcome both of your comments on this, but my read on this is everything we're doing fits with the rules that are set out in the executive order, and everything we're doing is going to be compliant with the state law.
Right. I agree. And so if anybody's confused where you see that we may be saying wear a mask and such, there are rules that guide us based on that state law, that if we have increased transmissibility, like we pick it up with our wastewater, that all of a sudden we see a lot's happening and it's spreading, then we have the discretion to be able to make sure people are masked and tested and so on. So we have been very careful to stay within the confines of the law and recognize there is a lot of discussion and media attention to this issue. But the fact of the matter is, it is a law. We work within the state of Arizona. The legislature and the governor have taken a certain path. But on the other hand, I think we have done very well in still advocating, inspiring, and doing everything we can to have people accept the best mitigation strategies based on transmissibility in their community, getting vaccinated, and wearing a mask, especially when we see that there is increased transmissibility in any given area. So as the president said, we have been very careful to stay within the guidelines. The president meets with ABOR on a routine basis. We speak to the governor and the governor's staff. I do almost on a weekly basis now. And so they are, in fact, very complimentary to what we're doing because we're staying out of the politics. That's not our job. Our job is to stay focused on how to get needles in arms and to get people healthy so we can put this COVID behind us.
I think the other thing that we always discuss is there's a lot of confusion between the difference in the higher education legislation and the K through 12 legislation.
Yep.
And for us, we're very careful to make sure that we're staying within the guidance and the guidelines of the executive order and the legislation, and saying that if, we are asking people to wear masks, but it's not a certain sect. It was very clear in the legislation that you could not mandate masks or require masks based on vaccination status. So we took the approach and went through our legal processes to really look at what could we do based on you doing it for everybody, where socially distancing is not continuously available. And I think, staying within that isn't going to change the way that we are operating, because we're still operating within the limits of both the legislation and the executive order.
And I think, Holly, that some of the confusion also is that the public reads the stories from the private sector, airlines, businesses requiring this, hospitals in Texas that are saying, well, you can't work here unless you, and so on. The private sector has the discretion to do what they want. And ultimately, these are becoming legal challenges. But the president and I and the leadership here at the university all figured, and the governor agrees, we can't wait until litigation occurs to answer these questions. It could be years. We have to act now. And so we're doing everything we can to get needles in arms and to get people to practice good public health mitigation strategies. But I can understand where the public, I get calls all the time. Well, I heard in Houston they're doing this, or in New York did that. And I said, yeah, and it's private sector, and the private sector can do what they want. Then they may be challenged by government, and they may end up in litigation about that. But that doesn't help us to keep people healthy today. Today, we are focused on everything we can do as a university and as a state to be able to encourage people to get vaccinated and take all of those public health precautions. So understanding it is very complicated. Our 50 states look like 50 countries on some days because there's so much variability in how different places are doing it. And I feel for our fellow citizens who they wonder what's going on. How come there's so much variation? Well, we've been 100% transparent, and we try and take that variability out of it, that the public that listens to us every week understands what we're going through, why we made the decisions, whether we agree with them or not. We're within the law. And that's the path that the president has put us on, which is the correct path.
Yep, I think that's it. So I'll turn it over to you, President Robbins. Final thoughts.
Yeah, thanks, Rich, for those explanations and kind of keeping everyone focused on what we're about. It's trying to educate, encourage, and get as many people vaccinated as we possibly can. So until next week, I would encourage everyone, wash your hands, sanitize your hands frequently, cover your face, stay away from as many people as you can. If you're going to be in gatherings, hopefully they'll be outside, and you keep your distance. Keep your own space. Don't invade other people's space. And as always, please consider getting vaccinated. If you're eligible for the booster, we're going to make that available to our university community starting October 11th. And until next week, bear down, mask up, and backs up.